The season of renewal. Spring is the perfect time to focus on your health and well-being. However, if you're suffering from IBS, it's difficult to focus on anything else. And these conditions are really bothersome. It doesn't have to be this way. April is IBS Awareness Month, and Dr. Jack Braha and patient Blanca are here to talk about the conditions and what you can do to help treat them. Good morning, you guys.
Good morning.
Good morning.
You know, I feel like IBS is something that so many people suffer from, but it's so taboo that we talk about it, and that's why I'm really glad to have you on this morning. So first of all, doctor, what are IBS-C and CIC?
Well, thank you for asking. IBS-C and chronic idiopathic constipation, CIC, are both very common disorders of the digestive tract where folks suffer from constipation. And there's one key difference I want to point out between IBS-C and CIC is that the irritable bowel patient suffers from abdominal pains or discomforts that are associated with constipation. And these are so common. Millions and millions, up to 35 million people have CIC, 13 million with IBS-C. And unfortunately, as you mentioned, taboo, we know that a large percentage, millions of folks, have yet to go to the doctor and receive a proper diagnosis. And in fact, studies have shown us that patients are waiting years before achieving a diagnosis and treatment. And I'm here today to talk about some of those treatment options which folks can see their physicians and hopefully benefit from.
Now, Blanca, what made you make the jump? Because I know a lot of us just say, you know what, I'm not going to say anything about this. I'll treat it at home. But what happened to you that made you just step up and go, I got to do something about this?
Great question. For me, it was specifically the lost time with my family. There were times where we would be watching a movie and they'd have to pause the movie for me to go to the restroom. I'd be in the restroom 4 to 5 times a day, up to 45 minutes to an hour sometimes. And that absolutely made me take that first step to have that conversation with my doctor.
So now, doctor, when we go in to talk to you, what kind of things are available now? What kind of new treatments can help us out?
Great question, and that's important. We want the patients to come in the door, know that there's treatments. Things like dietary and lifestyle modifications, like increasing fiber intake or water intake, exercise. There are over-the-counter remedies that could be available, and there are prescription drugs that are available like Linzess, which is approved for the treatment of CIC and IBS-C. And it's important to talk to your doctor about the risks and benefits. There are some side effects of all the treatments, as with Linzess. One of the most common side effects was diarrhea. And it's important to have this great conversation with your doctor.
Thank you both so much for coming on to talk about this. You can find out more by going to our website, fox4morningblend.com.